The winter is always a busy time for illnesses. The bird flu is making some headlines right now, but doctors urge caution about the seasonal viruses that are surging as we speak. Norovirus cases are very high, along with RSV and COVID-19. And the CDC says flu cases are raging. They're especially high across the Midwest, the West, and the Southeast, and it's expected to stay that way for weeks. Influenza type A is the biggest concern right now.
Those of us in infectious disease always worry about influenza. If you start developing any respiratory symptoms, you need to get tested.
So far this season, the CDC says more than 9 million people have caught the flu, and at least 4,700 people have died, including 17 kids. It's a serious time, so let's get to the heart of the matter with Dr. Dana Hawkinson, Medical Director for Infection Prevention and Control at the University of Kansas Health System. Good to see you again, my friend. It's been a little while, and now we're in the middle of flu season now. We've been hearing from viewers that emergency rooms, especially in our area, have been pretty packed as of late. What's the situation at your hospital? What do you see?
Certainly at University of Kansas Health System and KU Hospital, we have seen more admissions for influenza the last few weeks. We've also seen admissions for RSV, and of course we're always having admissions for COVID as well. But overall, the influenza has been greater the last couple weeks than RSV and COVID.
What's the severity? What's your biggest concern right now?
Yeah, so our biggest concern is what we see every year, really, and it's that influenza A. It's especially in those populations that are most at risk. So the very old, and the very young, but also those with comorbid conditions like diabetes and obesity and lung disease and heart disease. So we really have to be vigilant, and I would agree with that other physician. If you have symptoms, get tested, because if you can get tested early, you can get on treatment early.
The best way to protect yourself, I guess, other than good hygiene would be a flu shot, right? Is that still effective this late in the season?
Yeah, absolutely. We say, never miss an opportunity to vaccinate. We are still in a peak time of influenza infection. So although you are a little bit behind the 8 ball, you can still go get it, because we know right now the vast majority of influenza has been influenza A. But we are always concerned about a second wave. Most of the time that's influenza B as well. And so those influenza vaccines will help against influenza B also.
What about RSV? The vaccine was, I think, early on a little harder to get. Yeah. How do you treat that right now?
Yeah, so right now RSV, the best thing is to get vaccinated. So there is a vaccine for pregnant mothers so that they can develop immunity and give that immunity to their babies before the babies are born, because the most at risk, again, are the very young, but also the elderly. So there is also a vaccine for adults 60 and over, and these vaccines have proven to be very safe and extremely effective at reducing hospitalization and severe disease.
Mm-hmm. Is it tough when you have several sicknesses like this kind of all at once?
Yeah, but we have to be prepared for it. And we have, decades of data. We understand respiratory viral season. We now, with RSV vaccine, we have one more tool to help prevent people going to the hospital and having severe illness. We also have, of course, influenza vaccines, and we have the updated COVID vaccine. So it's very important. All of these things are proven to be safe, and they will reduce your chance of severe disease and hospitalization. So it's vitally important that you do stay up to date with those vaccines.
We mentioned norovirus right off the top. Let's say you picked up one of these bugs. Apologies if you did over the holidays, because norovirus is rough. Yeah. Is there any period of immunity afterwards or something like that?
You will have a little bit of immunity. Again, for norovirus, you may have some immunity for some amount of time, but you can get reinfected. Certainly for these other viruses, again, you will have some immunity against getting reinfected in the short period of time, but after several months, you can certainly get reinfected with them.
And I know we mentioned vaccines, and I know that it's easier said than done, especially now when it's colder out and people are inside more. Should you isolate if you have any of these viruses right now?
That is one of the great things to do to help protect other people, certainly, is to isolate. We don't want you to go to work if you're sick or go out in public if you're sick. Certainly, we understand there are economic burdens and people do need to be at work, and childcare and issues like that. But certainly isolating at home until you have resolution of fever or improvement in your symptoms is always a good thing to help those around you as well.
Every little bit helps.
Absolutely.
Dr. Dana Hawkinson, thanks for your time.
Thank you very much.
KMBC 9 News is keeping you safe as we watch the spread of viruses in our area. Look for updates and ways to protect you and your family on air and online at KMBC.com.